is always challenging because it's related to longer operation time, and we have a high risk of complication because it's difficult. There is for the surgeon, there is no more. Sometimes there is no more anatomical landmarks, and we have to battle with the epidural fibrosis. And really, my obsession when I'm doing a revision surgery is to bridge the dura or the nerve rods. And you know that when you have a revision, in 99% of the cases, you have the dura and the nerves are covered by scar tissue and fibrosis. I started my experience with this new product. I thought it was a miracle device. It's not a miracle device. You have to think about this. Surgery is still surgery, but after 2 cases, I was convinced that it's useful for the surgeon because it decreased significantly the dural tears. Because in my study for my theory, I had no dural tear. I promise you nothing, and I'm sure that the intraoperative bleeding is very poor. When you use this product, you have to put it on the surgical field. You have to let it act, and then only you start your dissection with applying a mechanical force to bring the disulfide bridges into the fibrosis. And finally, it reduced the operative time and the post-operative complication, especially when you decrease the bleeding during your surgery and when you decrease the number of dural tears. I use it for arthrodesis revision. It helps you to remove the material. It's amazing. It's really helpful. The Messna is not a solvent like a remover for a nail polish. It just helps you to dissect the fibrosis and to find a different plane when you are doing your surgery. In case of a revision surgery in spine, sometimes you open the skin, the muscles, and you find 2 or 3 centimeters of fibrosis before reaching the dura. You have to remove it mechanically, and you have to use the CADISS only at the last moment when you are close to the dura, when you have only 2 to 5 millimeters of fibrosis close to dura. Use the CADISS.
Really, I was convinced that this CADISS has applications in musculoskeletal surgery. We are confronted as musculoskeletal surgeons, whether orthopedic or plastic or general surgeons, to 2 types of fibrosis. It can be primary fibrosis or it can be secondary fibrosis. The primary fibrosis is, for example, at the end, Dupuytren disease. There is almost always after a first removal of the nodules and of the bundles recurrence. Sometimes the recurrence is not a problem for the patient, but many times the recurrence is very severe, and then it has a lot of fibrosis and is very difficult to operate to preserve the bundles, and sometimes it ends up by amputation of the finger. So secondary causes of fibrosis are very frequent. They are a part of healing of any mesenchymal tissue lesion. But if it involves the tendons, especially a tendons of the hand, it will lead to gluing of the tendon to the sheath, to the aponeurosis to the bone, which causes stiffness and dysfunction. We believe that in the future, it's very possible, but the experience is not yet there. Maybe you like to join for a trial of the CADISS in Dupuytren disease, especially recurrent Dupuytren disease, in the tenolysis, especially at the hand where the function is so important after, for example, phalangeal fractures with extended tendon that are glued on the dorsal cortex of the phalanx, but also in perineural fibrosis. You know that we are confronted to, when we do revision of nerve lesions or like this median nerve on your right or brachial plexus, to very severe adhesions. Well, we know that CADISS is safe our peripheral nerves. So we believe that it will help a lot in the dissection to avoid heterogenic lesions to tendons, joints, and nerve, and maybe if also sometimes to reduce the blood loss. So